Yeah, I think we don't have much time. I'm just gonna go through the analysis, very quick one. When I look at Asian patients, the first thing I look at them is looking at the zygomatic bone, the protrusion. If you can see, most of us has one bone structure that's higher set, and one side is low set. So most of the time I'll discuss with the patients and tell them that okay, this side is higher, so I might want to sort of put a little bit here that will put some volume at the corner that will help to tent this up a little bit and make it slightly more symmetrical. She's 41 years old, it's like a year older than I am, but she had her forehead done before last year, I think, and you can see a little bit of bulging in the temples, but compare on the other side, it's a little bit of hollowing. I might or might not do because I think it's just right, but because of this hollowing, you can see that this is a bit of a lazy eye, as well as the brow tends to pull up a little bit more, and I'll just put a little bit right here to help her to balance out a little bit. The other area that I'm going to do is canine fossa as well as the mandible angle, and I'm going to start right now. While I'm doing it, I think you guys can discuss if you would do it differently.
Michael, I know you have a lot of experience and of travel and treating Asian patients.
Looking at her, I agree with what Tim Sung says, but again, if I were to pick one spot, I'd be picking her upper medial midface. You know, just below the little infraorbital fat bulges. I think she would look great with a decent little augmentation right there.
Michael, you mean right here, right?
Yes.
Okay, exactly. That's where I'm actually going in.
Okay. All right.
So tell us your depth and...
So I'm actually deep at the supraperiosteal area. I'll go as deep as possible. And I put about 0.05 cc over there, and not more. And I move towards the side, glide the cannula to the side corner of the eyes, and I put about 0.1, spreading it just on top of the bone, the orbital floor. And I do go to the lateral canthal, so lateral orbital thickening area, which is lateral canthal, just very close to the orbital rim, and just put tiny little bit there, about 0.1. As you can see, by just putting that volume, I think it does change the whole structure a little bit. Can you see that for me? You see it's actually bring it up.
So in terms of the amount, again, in total?
So it's 0.05, here it's about 0.1. And I use it in the deeper structure. Just now I was using actually bilateral volume. And I believe by putting a little bit of fillers in the deeper structure and followed by another softer fillers on the superficial area, I do not concentrate, I don't bolus them, but I actually spread them into, sort of sandwich them a little bit. So in that case, I can use very small amounts of fillers to complete the task.
Yeah, I think the deep fillers can give you such nice structure and shape, but the superficial fillers, you really get something really subtle from it. The superficial shaping is, I think, really is where you really get fine shape.
Yes, exactly. And now I'm actually at the superficial, slightly going superficial, and you can see the movements of my cannula. And I'm putting this time bilateral balance. And another 0.05 cc, I actually spread it. So I move around a little bit. I do a little bit of, it almost looks as if I'm doing some subcision, but I'm not. I'm actually just placing it, just micro droplets around it. 0.05, I'm going to move towards the corner of the eyes again. And this time I'm going superficial. But I try not to put too much here because it will give them lumps if you put too much. And especially if I think when you put fillers superficially, it tends to attract more water. And when you place big boluses, definitely you'll get more trouble with it.
So Michael, your technique, particularly for the superior medial part you were talking about, what would you do?
I'm a needle person just about everywhere except for the dorsum of the hands. So it would be needle. I do not like boluses or large amounts. I like sort of how Tim Som's doing this, although I don't use a cannula. I still do lots and lots of little threads. You know, we're talking about migration. I think everything can migrate a little. I don't think things really migrate a lot, except for, say, in the deep plane of the forehead where there's just that loose plane. Their stuff really can migrate. But in the face, I don't think it happens, but still I like the idea of all those discrete, like 100 little threads, each in their discrete little pocket. And there I think you get less migration. And the whole idea behind that, besides that, a little more control is, it's the way to have the most surface area per volume. And I like small volumes. And we know from the Lang and Voorhees paper that HA interacts with fibroblasts when it physically touches them and deforms them, and they upregulate and start making out collagen. So you, in my mind, I want as much surface area as possible. That way I will interact and turn on more fibroblasts per unit volume. And that's lots of little threads in there.
Isn't he injecting into the zoof, or is he in the area of the zoof?
I think you are in the SUF. The question was from Gerhard,
Yes.
you're injecting in the SUF, lateral and medial.
Yes, exactly. Yeah. And this is, I've done one side of face, actually. I don't think she needs a lot. So what I did is I sandwiched on the infraorbital area as well as lateral side. And I did put a small amount, 0.1 cc at the canine fossa, followed by 0.1 cc at the mandibular angle. As you can see, this side of face is slightly lifted. I don't really chase after the lines, and I think sometimes it's like this kind of lines is not worth chasing. Most of the time, it's also some skin laxity. I think we need to combine with other modalities to help. But what I've tried to help her is, you can look at this side of face is slightly lifted. The corner of the eyes has moved up. The brow looks more relaxed, even though I did not touch anything on top. But I do believe when you actually sort of give support to the orbicularis oculi, it does affect the frontalis as well as temporalis muscles as well. And by doing that, I completed one side. It sort of gives them the lift that they need, and it looks natural. Can you smile for me?
Yeah.
Right.
So things on that looks great, really fantastic. What to do is, what you've demonstrated to me, remember with the whole, when we started off this talk, we were saying, how do you keep the person looking like themselves?
Yeah.
So there's a study, like if you ask a computer to look at this patient's face, right, and then they say, right, okay, what is making that patient look like her and me like me, right?
Right.
So what the computer does for artificial intelligence is there are 6 lines on my face which makes me me and her her. Those are the ones that are coming down from underneath the eye across her cheek like that. If you get them the right shape, even if they're bigger or smaller, you keep her identity. If you make, even if it's not very much, but if you basically change the essence of that shape, you change her identity. A computer will not be able to recognize that person if those 3 lines that come down here change shape. What Tingsal's just done is kept the essence of that shape, and so we keep her identity. So she doesn't just look better. I think we keep the essence of that shape. So I think that's fantastic. Thanks so much. Do you have your patient?
Oh yeah.
She's ready to be shown. So we also have Danny's patient from before.
Yes, I think she just left the room. Was it?
Just to, as last was our last round up.
The other patient.
Just
Yeah.
have a little
Will you
look
get the other patient?
and
I think
just
she
see
just
how
left the room.
oh, she's left.
Yeah.
Oh.
The other patient.
Okay,
Subject here.
so
Oh,
in
okay.
summary, thank you so much for our panel here. Thank you for your insights and for your years
Katie.
of
Okay.
experience.
We managed to get the patient back.
We
You
pulled
want to
her
have her
back
put
in
on the
from the
podium?
concourse.
Yeah. All right.
Yeah,
Sure.
yeah. It was just 30 seconds. We'll see this patient here.
Right.
Okay. Okay, so just to round up here, just from Daria's point of view, we just, oh, she looks lovely.
Yeah.
So, and just look, if you see that the planes here, she has, behind her masseteric cutaneous ligament is smooth, and she has fineness and strength along her jaw. If you tip her just to the side here, you can see that she has strengthening of her jawline, as well as smoothing of her transition across her face.
And I only used 1.5 syringe for.
And 1.5 syringe. Okay. Thank you very much, and thank you
Alright,
for
thank
attending our
you.
session.
Right.